Hi, I'm Ashley from Psych for Life, and today we'll be talking to Emma Lauer, a licensed social worker and therapist at Find Your Shine.
My name is Emma Lauer, and I'm a mental health therapist. I work in private practice most of the week, and then I also work about 10 hours a week at a community mental health agency.
Can you walk us through kind of the day-to-day things that you do at both?
So at the private practice especially, the vast majority of my time is spent actually in session with clients, actually being in therapy, conducting therapy. That's the vast majority of what I do. At the community mental health agency especially, there's some case management as well. So in community mental health, there's like a lot of paperwork, a lot of keeping their charts up to date with different assessments and making sure we have different forms on file, those kinds of like red tape things. I do a little bit of case management, which means setting up appointments, calling people to check in with them, see how they're doing, maybe every once in a while coordinating with doctors like psychiatrists or NPs or other therapists. Like for example, I have an adult who has a couples counselor that she's working with her husband, and so I might coordinate with people like that. And then I also have supervision once a week.
Can you tell us what populations you work with?
Yeah, so at the community mental health agency, I exclusively work with kids. And at the private practice, I work a lot with kids and adolescents, and I also have a large handful of adult clients as well. One of the first questions that people will ask me is, what do you specialize in, or what do you work on specifically? And it's kind of a huge range, to be honest.
Sounds like it.
Yeah, I mean, I have sort of I work with adolescents, and I treat a lot of self-harming behaviors, so I have a little bit of a specialty, and especially with all of my experience with kids, but yeah, I treat everything from anxiety, depression, bipolar disorder. I have a few clients with eating disorders, so it's kind of all over the place.
What is kind of the best part about what you do? Because I feel like you really have your hand in so many different things.
So one of the common themes amongst all of my sessions and all the types of clients that I work with is that, you know, they're all human beings, obviously, and they all need basic things like to feel heard and feel validated. And that's deeply rewarding, to be that person that's there for someone, to help them feel heard, validated, to be supportive, to be that unconditional positive regard. You can really make a big difference in people's lives. And you know, my job isn't to like work my magic and make changes. My job is to help people make those changes for themselves. And when you see that happen, that's really rewarding for sure.
What would be the hardest part then, what you do?
I think the hardest part might be making sure that I don't take on too much personal responsibility when maybe things don't go the way that we want. You know, a lot of times people may not feel like they're making progress fast enough, because change can happen really slowly, right? And I always tell clients that change doesn't look like this, right? Where you just work and it gets better and better and better. You're gonna zig and zag, and things are gonna come up roadblocks, and you're gonna have challenges, and you might take like 2 steps back before you take 3 steps forward. And those are hard things to keep in mind sometimes, for sure.